Hi, I'm Christina O'Flaherty. I'm a clinical psychologist in private practice in Washington, D.C., and I also offer online sessions. And today I want to talk about a topic that is very close to home for me and is why a lot of women come to see me, and that is miscarriage, pregnancy loss, and loss of a newborn. I've been talking in my previous videos about sort of being on your own side when emotions run high, and something called self-compassion, which is basically having your own back, basically. And I often talk about this concept in therapy, and I talk about it with people who've experienced pregnancy loss and newborn loss. And it's something that people, myself included, have struggled with. And that, for one reason for that, is that we are really, as a society, taught to minimize the pain of, say, a miscarriage. You know, we hear this all the time. People will say things like, at least it was early on in the pregnancy, or your body took care of a pregnancy that wasn't meant to be, right? Or look on the bright side, you can have more children. And we're also not supposed to really talk about this. I mean, there's sort of a message that it makes people uncomfortable, and so we should be quiet about our pain. And that is one of the worst things that we can do to ourselves. So it is not compassionate to ourselves. The other place that people really struggle with this idea of self-compassion when it comes to a pregnancy loss or newborn loss is the idea of connecting with other people, or understanding that this experience is a common human experience. Not that many people lose a newborn. This is true, and it is extremely isolating. It can feel you can feel very alone in the experience. And the same is true for miscarriage, because it's so shrouded in taboo, really. So how do you connect? How do you get this sense of connection with other people and their experience when it feels like it's very particular to you? So those are the two ways that people tend to struggle with self-compassion when it comes to loss like this. And sometimes what I notice is that a client is doing this to themselves. They are telling themselves that that they shouldn't feel so sad about a baby that they never knew, or a baby that they never met. And that is a way for them to distance from a really painful experience. It's a way of holding their pain away. I shouldn't feel this, rather than bringing it in and allowing it. The problem with that is that it leaves us really stuck and alone in our grief. Grief that is valid and normal and natural to feel. And it keeps us from talking about it. So it keeps that shroud on the topic. And the other way is that often people will hear these statements from really well-intentioned, good people, and they'll feel that they should minimize their pain, that they should put on a smile and a happy face and go on with their life, or not talk about it. And for some people, that's the way they deal with things, and that's okay. But for others, it feels like living in a prison of your own pain and your own experience, and it's very lonely. So the idea is to really allow this pain, and allow whatever it is you need, to talk to friends, to find people who are supportive, to actively seek out support from other people. And that's where the connection part comes in, because we find, as we begin to talk, that Maybe someone hasn't experienced the exact same loss as you. Maybe it's a different kind of loss. They lost their mother or their father or a sister. And while it's different, there are different qualities. There is an understanding overall of what this is in life. That loss is tragic and it hurts, and it doesn't matter what someone else has experienced or whether or not we think our experience isn't as bad as someone else's. Pain doesn't come with like a rating score. It just hurts us. We feel it because we're supposed to feel it. We're meant to feel it. And that is how we sort of open, by talking about this, by allowing our grief, allowing our pain, and sharing with others. That is how we connect, and that is how we understand our pain as being part of something wider and broader, which is part of what it is to be alive. Loss, unfortunately, is a part of life. And sometimes we actually have to seek this out. We have to find people who are willing to be with their own feelings enough to be with ours. Whether that's a therapist or a support group or an online group or a best friend who totally gets it somehow, even though she's never experienced it herself. It is our task to actually find this network. And for some people, that's harder than others. So if you're watching this and you have had a loss, I am so sorry for your loss. And I hope that you will learn to treat yourself with kindness and will allow your pain to be present, to be kind to yourself in pain, and to actively seek support for your suffering. Thanks for watching. Hope it was useful. Bye-bye.